According to the CDC, the flu virus is now widespread in 30 states and has impacted between 6 and 7 million people this season.
OSF Healthcare Director of Physician Practice, Dr. Brian Curtis, joins us now to see how some chronic illness could have an impact on how the flu affects you. When it comes to this kind of stuff, obviously, there's a lot of people that can be in a more prone area. Talk to us about some of the more high-risk folks.
So obviously children under 6 are really high risk. People over the age of 65 are another high risk category. And then people with chronic liver or kidney problems. Obesity is a risk factor. Asthma, COPD makes you more prone to develop more respiratory complications from the flu. And then the ones that people don't think a lot of are pregnant women are a high-risk category, and then women that had just delivered a baby are a high-risk category, and they definitely need to be immunized because they're very, very high risk of getting complications from the flu.
And you were telling us earlier a statistic about the people who are dying from the flu compared to those who had a flu shot or not.
Yeah, so this year, when you look at the data, about 80% of the mortality from the flu this year have been in unvaccinated individuals, and then the other 20% are people in the high-risk categories. And so really, again, it tells you that there is something you can do to help prevent serious complications of the flu.
Now, when you were mentioning some of those more at-risk people, when it comes to the women that have just delivered, why is that an area that also makes you high risk?
They're just at a high risk. I mean, their bodies have gone through a significant change. I mean, they had a baby, now they don't have one, and so that creates a lot of a kind of turmoil within the immune system within your body. And so it really sets them up to get a very aggressive form of the flu. And so really can't encourage you enough. If you're pregnant or you just had a baby and you've not had your flu shot, you need to go get your flu shot for yourself and for your baby.
What have you observed this year in terms of how effective the flu shot has been this season?
Yeah, so we're kind of early into it, so we're just kind of getting into the ramp-up phase of the flu, which is kind of our normal. But what we're seeing around the country in this widespread is that there's 3 circulating viruses right now, and they're all in the flu vaccine this year. And so the predominant one that's circulating is H1N1. That was a predominant strain back in 2009 when we had that bad flu year. So it's back this year. And so again, it's one of those flu strains that we don't see a lot. And so if you haven't had the flu vaccine, you're at a serious risk when you get that virus to having a bad flu.
Well, thankfully, we all got our flu shots live on TV back in September, I think it was. But for folks that maybe they've already gotten their flu shot, what other things can they do to help protect themselves and their family? Yeah,
and so it's, you know, cough or sneeze into your elbow. If you wipe your nose or cough in your hands, make sure you wash your hands or sanitize your hands. And then if you're sick, stay home. Don't go to school, don't go to work, you know, only go out if it's absolutely necessary. And that's actually to protect other people and to yourself. And we know that people stay home and take care of themselves, get some rest, hydrate themselves, actually get better faster than the people that try to just muscle through it.
And let's remind people about the symptoms too, because I know in the past people have kind of thrown around, oh, I think I have the flu, like it's a cold.
Yeah.
What should people look for?
So the flu is high fevers, myalgias and arthralgias, which are muscle and joint aches. You can have a little bit of nausea, but the predominant fever is headaches, muscle aches, joint aches, and that's it. And people can really describe it. Usually they can tell you the time it started. They'll tell you I was feeling good till 8:59, and then I just felt really, really bad. And then the flu lasts, you know, 7 to 10 days, and so the people that are sick for 24, 36 hours probably didn't have the flu. But if you had the flu vaccine, you still are at risk for getting it, and you may have a shorter duration of the flu.
Okay.
All right. A lot of very good things to keep in mind, especially as flu season is ramping up. So we appreciate your time and giving us the rundown, Dr. Brian Curtis. Of course, we'll share this interview over on our website. Just head to ciproud.com and click on the Good Day Central Illinois tab.